Hello, I'm Dennis Quaid. A pioneer is defined as a trailblazer, someone who develops a new way of doing things. Nowhere is this truer than in the field of healthcare. Every medical advancement starts with a pioneer who explores and digs deep in the name of science. Here's one such story.
PPE. It's a term most Americans didn't give much thought to until a worldwide pandemic made it a household term. The unprecedented demand in 2020 for personal protective equipment, such as masks, gloves, and gowns, rapidly transformed the global PPE market and sent the supply chain into a tailspin as manufacturers raced to ramp up production and distribution. With the PPE market poised to grow by more than $8 billion by 2024, innovative methods will be necessary to meet the demands of this dynamic industry. Medical device industry expert Sam Kumar explains.
Historically, majority of PPE supply has been produced in the Far East, in particular China. As COVID cases surged in China, these manufacturers were forced to deploy their capacities locally to meet the local demand. US-based suppliers were forced to look elsewhere worldwide to find supply for PPE. I think 2020 was the perfect storm in that it highlighted the weaknesses in the US healthcare supply chain.
Here in the US, medical suppliers had to think outside the box to ensure continuous delivery of PPE products, even at the height of the pandemic.
Early in the start of the pandemic, one of the largest health systems in the country reached out to us to get help with locating a reliable supplier of N95 and surgical masks. The challenge was locating a supplier quickly and to deploy capacity efficiently. In a matter of 6 weeks, we were able to qualify a supplier and set up a supply chain to deliver these high-quality masks to this US customer. Today, we continue to supply Level 3 face masks and N95s to several of the largest health systems in the country.
As part of the federally funded CARES Act, MYCO Medical played an important role in providing the North Carolina Hospital Association with much-needed supplies, such as masks and thermometers.
The North Carolina Healthcare Foundation, a division of the North Carolina Healthcare Association, was granted $25 million by the state of North Carolina specifically for the purchase of personal protective equipment. We were able to work with MYCO Medical to source N95 masks and other products that were not under our group purchasing program's portfolio. We now have a specific initiative to work with more North Carolina-based and minority-owned companies here in the state of North Carolina.
Committed to keeping up with the ever-changing needs of healthcare during the pandemic and beyond, innovative companies like MYCO Medical are proud to be able to enhance outcomes, lower costs, increase efficiencies, and improve safety for healthcare workers and patients alike.
It was my goal then and now to create competition for some of the large brands in the US medical device arena that seem to have monopolies in these critical areas. It is very exciting to see these products being utilized and deployed at various large health systems in the US. We plan to continue to provide our clients the safest and highest quality products on the market now and in the future.
Today's advances give us hope for a healthier tomorrow. Thank you for joining us. I'm Dennis Quaid.